Hi everyone, and welcome to La Trobe University's Virtual Open Day for 2020. My name is Monica Peddle, and I'm the Undergraduate Nursing Courses Coordinator in the School of Nursing and Midwifery here at La Trobe. Today, my colleague Sharon and I are going to outline for you the various undergraduate nursing and midwifery courses that are available here at La Trobe. I'm just going to take a moment here to pause about the information about the courses to outline for you the employment outcomes for our 2019 graduating cohorts. In the Bachelor of Nursing and Bachelor of Midwifery, 100% of our graduates were employed in full-time work 1 month after graduation, and over 90% of our Bachelor of Nursing graduates were also employed in full-time employment 1 month after graduation. It's also worthwhile noting here future career opportunities, particularly in nursing, where it's estimated there's going to be a shortfall of over 109,000 nurses in 2030. The Bachelor of Nursing at La Trobe has 3 pathways. There is the Bachelor of Nursing 3-year pre-registration degree. This program is available for all school leavers and mature age entry students. There is also the Bachelor of Nursing Enrolled Nurse program. This program is available for those students who have already completed a Diploma of Nursing and are registered with AHPRA as an enrolled nurse. There is also the Bachelor of Nursing Graduate Entry pathway. This program is available for those students who have already completed a prior degree. In the Bachelor of Nursing Enrolled Nurse pathway and the Bachelor of Nursing Graduate Entry pathway, these students are eligible for 120 credit points of advanced standing for Year 1 of the program. At La Trobe University, all our first-year students undertake first-year subjects on campus here at the Melbourne campus based at Bundoora. This enables access to learning support and the library for the students as they transition into higher education. From Year 2 onwards, students undertake the course in a clinical school model of education. This model sees students undertake classes co-located at one of our major clinical partners. We have partnerships with Alfred Health, Austin Health, Northern Health, Royal Melbourne Health, and our major maternity hospitals in Melbourne. These clinical schools are staffed by expert academic staff and clinical experts who remain engaged in the clinical space. The facilities provide opportunities for students to be prepared for the clinical space and build their confidence in working within their clinical school's environment. Clinical supervision during clinical placement is provided by nurses and midwives who work in the clinical facility. By using the clinical school model of education, students become familiar with the clinical environment and the hospital becomes familiar with our students, which leads to our high employment rate for our graduates. Information for entry into the courses can be found on the La Trobe University website. For your information, the minimum selection rank for the 3-year pre-registration Bachelor of Nursing degree was 64.85. The minimum selection rank for the double degree in Nursing and Psychological Science was 66.3.
Thanks, Monica. My name is Sharon Mumford, and I'm a lecturer in midwifery and the course coordinator of the Bachelor of Nursing and Midwifery here at La Trobe University. So what is midwifery? Well, midwife means with woman. Midwives have existed for as long as babies have been born, and reference are made to midwives in ancient Greek and Roman texts, and in the Bible. Traditionally, knowledge about midwifery passed from woman to woman, midwives made by apprenticing at an experienced elder's side. The foundations of midwifery being developed and recognised as a profession started in the early 1900s and is now regulated under specific national health standards. The art of midwifery has a colourful and rich history, and this is integrated into the Bachelor of Nursing and Midwifery course. So who needs a midwife? Well, all women who are pregnant, during labour and birth, and postnatally need a midwife. Midwives work collaboratively with other health professionals to ensure that a woman's unique health needs are met during their journey. All women on this journey have a degree of vulnerability, and part of a midwife's responsibility is to engage in a multidisciplinary team where necessary to support women and their family. So why study nursing and midwifery at La Trobe? Well, to consider this question, there are 4 points of reference. So adaptability. There is a balanced approach to learning at La Trobe University. This approach is taken to not only address different learning styles, but to also maximise resources available to enable student learning. Industry connections. Our priority is to assist students to be well prepared for the essential clinical components of their course. To achieve this, La Trobe University is connected with some of the finest hospitals and healthcare centres, both nationally and internationally, to support learning in action. Career Ready. There is a strong connect between the metropolitan and rural schools to achieve success for students. La Trobe academics foster the relationship with clinical partners by being based on-site with the clinical schools. This drives a best practice approach to teaching and learning as we work towards students being career ready. Excellence in research. La Trobe University is rated well above world standard when it comes to research in nursing and midwifery. Teaching staff are integrated into these teams and so by virtue offer students the most contemporaneous evidence-based approach to healthcare. International opportunities are normally available in this course. Included on the slide are examples of past experiences. Details of opportunities will become available soon. The School of Nursing and Midwifery have international placements and a coordinator of this, Jackie Johnson, whose contact details are available via Ask La Trobe. So how do I enter a degree in nursing or nursing and midwifery? Well, that depends on the type of group you're categorised as. So that is either a recent school leaver or a non-Year 12 applicant. So depending on the category you lie within, it's your ATAR and prerequisites for the school leavers, and for the non-school leavers, special entry access scheme. It could be higher education that you've done previously, it could be vocational studies, and the SAT, so the Special Tertiary Access Test, to see your ability to attain an undergraduate entry-level standard. The Bachelor of Nursing and Bachelor of Midwifery double degree is offered both in Bendigo and in Bundoora. The two schools work collaboratively to offer a consistent course across the two sites. The details of application requirements through ATAR and prerequisites are all available on the Resource tab on the La Trobe University website. So what will the course involve? Well, it's a combination of theory and the academic assessment and practical assessment that's undertaken by our clinical partners in industry. The actual breakdown of the course and the subjects within the course is available on the Resource tab on the La Trobe University website. The curriculum content and structure is ANMAC accredited, and this must be adhered to in order to course complete prior to registration as a health professional. Monica Peddle is the course coordinator for the Bachelor of Nursing. Maria Murphy is the coordinator for the Bachelor of Nursing and Psychological Sciences, and myself, Sharon Mumford, the coordinator for the Bachelor of Nursing and Midwifery. If you have any questions about the presentation today or any of the courses that we've discussed, please don't hesitate to put them in the question box. Thanks for watching.